Hello, how are you? Okay, my name is Dr. Elo, and I'm going to be performing your cranial nerve exam today. I saw in your chart that you have had a cranial nerve examination before, correct? Okay, and do you recall if they found anything atypical? Okay. Alright, well, we are just going to be taking another dive into the same sort of sensory tests that you're probably familiar with. If you do have any questions along the way, though, feel free to ask. Okay? Can you tell me your date of birth? Okay, perfect. 902. Alright. So we're just going to start with your eyes, okay? I'm going to first feel around your eye sockets and ask you to do a couple things for me, okay? Alright, so if you can just close your eyes for a moment, I'm just going to sort of press on the skin and the bones that are here making up your eye socket. Feels pretty good to me. Okay, and if you could just close your eyes nice and tight for me now, I'm going to try to open your eyelids and don't let me, okay? So resist. Good. Again. Good. I'm going to go back and do that left side again. Squeeze tight. Okay, and the right side one more time. Okay, you can relax for a minute if you'd like, and then we're going to go in and do the bottom ones as well. Ready? Okay. Keep them nice and tight. Good. Close, close, close. Good. Once more on the left. Great. And the right. Great job. Okay. Just going to do a little bit of sort of massage movements around your eyes now as well, just to see if we get any sort of reaction out of the tissue. Have you noticed any swelling, general inflammation, any new puffiness around your eyes at all? And how about light sensitivity? Has that changed for you? Okay. And are you generally pretty sensitive to light or no? Okay. Do you wear any prescription glasses or contacts? Okay. Okay, I'm gonna check your pupil dilation now. I'm gonna use my otoscope for this rather than the brighter light, because we just need to see if they're gonna dilate, and this is enough to check that, okay? So I'm gonna place my hand in between your eyes in order to sort of shield the light from one side to the other, and I'm going to be checking both for direct pupil dilation and consensual pupil dilation. What this means is I'll shine the flashlight into one eye and block the light from the other, but both pupils should dilate because this one will be responding to the light in that one. That's the consensual, and this is the direct. Okay? Alright. So just line up here and look for the direct. Okay, and we'll look for the consensual. Good. Okay. Just blink that off for a moment, and we're going to do the same thing, going the other way. Okay. Excellent. Ready? Okay, so we'll look for the direct first. Seems good. Very responsive, and we'll do the consensual as well. Okay. Okay. So now I'm going to bring out the brighter flashlight here. We're going to do a few tests. In this first one, I'd like for you to just stare straight ahead. You can look at my forehead, nose, mouth, eyes, spot behind me on the wall, on the picture. Whatever works, just pick a spot relatively forward and don't move your head. I'm going to bring the flashlight in, and I'd like for you to just say yes, now, or make some sort of noise to let me know when you see the light in your field of vision, okay? So don't move your head, stare straight, and let me know, okay? Good. 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 Okay. Good. Okay. And relax. Okay. We're going to do a similar exercise with my fingers first. I am going to look deeper into your eyes with the flashlight in a moment, but that can be a little jarring and blinding, so let's finish the ocular exams first, okay? So first I'm going to hold my fingers here in the center, and I'm going to pull them apart, and this time I'd like for you to tell me when you cannot see them anymore. Okay, and don't worry about when I bring them back in, that's not part of it, just when you can't see them, okay? Again, just stare straight ahead. Okay, here we go. Good. I'm going to start off with these horizontal. Good. I'm going to do some diagonal as well, and some vertical. Good. Great. Good. Well done. Okay. Can I just have you look at my finger and then back to the wall? Finger. Wall. Finger. Wall. And finger. And back to the wall. Good. Okay. Next, what we're going to do, I'm going to be bringing, one of my fingers into your field of vision again. I'd just like for you to let me know whether or not that finger is wiggling or moving in some way. So if you see a static finger come into your field of vision, you don't need to say or do anything. If you see one and it moves, let me know, okay? So we'll do 2 fingers for this, and I'll stand a little bit further back. Alright? Can you see my fingers here, okay? Good. Alright. So we'll get started now. Good. 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 Very good. 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 Great. Good. And one more. Okay, good. All right. We're done with all of those sort of movement exams, and your vision seems to be good in terms of responsiveness. You seem to be able to tell when things are moving and when they're not, which is excellent. There doesn't seem to be very much damage with regards to your eyes' reflexes, which is great. So next, we are going to take that deeper look into your eye. I am going to be moving your eye a little bit, looking deep into your eye, and I may ask you to look in a different direction for me. Okay? Alright, so you can start off just looking forward. We're gonna come in here. Look up for me, just up. Okay. Can you look to your right? Look down for me. Okay, I'm gonna pull down your bottom lid and look up for me again. Good, alright. I'm gonna do the same thing on the other side. Okay, so I'm just gonna start off looking in. Look up for me. Look to your left. Okay, and look up again. And look down. Good. Okay, that looks great. Okay, next we're going to do your sense of smell, okay? So I have here 5 jars. They all have a different liquid in them. Shake them up a little bit. Each of these liquids smells like something different. It should be a pretty familiar scent, okay? So I'm just going to waft this under your nose, and I'd like for you to take a nice deep inhale and let me know what you smell, okay? Lemon, great job. Okay, next one. Cherry, well done. Okay. Yeah. Yeah, don't overthink that one. It is vanilla good. cinnamon. Good. Yep, it's just a floral scent. Good. Okay. Alright, next I'm going to bring out my otoscope again and check in your ears, okay? Alright. Okay, so while I'm looking around here, please do let me know if anything's uncomfortable. But I did want to ask, have you been having any issues with your hearing? Any hearing loss? Any ringing? No, okay. Have you had any pain or tenderness in your ear, rather on the outside or the inside? Okay. Have you felt a full sensation? Any other pains or just sensations in general? Okay. Okay, I'm just going to whisper some words into your ear. You just repeat them right after me, okay? Sheep, tree, star, box. Good, okay. Same thing on the other side here. Okay. Have your ears felt similar from side to side? No symptoms on one that you didn't have on the other? Okay. Was your hearing loss initially affected whatsoever? Okay. And did you have tubes in your ears at any point in your life? Any major ear infections? Okay. Good. Okay, and again. Car. Taxi. Train. 86. Good, okay. Well done. Okay. We're going to get to a taste test in a moment, but first I do want to examine your mouth and make sure there's nothing obvious that could get in the way of some good results here. So if you could just open for me, say ah. And go E. Stick your tongue out for me. Can you go one side? Far out. Good. And then the other side. Good. Just looking at the sides of your tongue there. And if you could tilt your head back a little for me and open up wide, I'm going to look at your teeth here. Okay, and down just slightly. Open. Okay, good. And I'm going to look in the back of your throat, and I need you to hold the ah noise for me, okay? So just ah. Good. have you had any pains, sores, toothaches, any sort of change in your sense of taste? No? Okay. I'm going to have you exercise the muscles of your face for me a bit now. Okay, so if I can get you to smile with your mouth closed first. Good. And with your teeth. Okay, and puff your cheeks out and don't let me collapse them. Keep holding it, keep holding it. Okay, you can relax. Okay, can I have you press your tongue into one of your cheeks? Good. Push. Okay. And the other side. Push. Okay. I'm going to place my hand right here alongside of your jaw, and I'd like for you to just turn your head into my hand at about 50% of your strength, okay? So just turn, 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 turn. Good. Other side, same thing. Just turn into that hand. Great job. Okay, can I get you to shrug your shoulders up for me? Again. Once more. Good. Turn your head over your shoulder. And the other way. Get back to center. I'm just going to feel along your throat. Back to center. I'm just going to feel along your throat here. Good. Feels really good. Okay, we're going to move on to the taste test now. Alright, so I have 6 tiny little jars here. Each one's going to represent a different taste, and I have these strips that I'm going to dip. We'll use both ends for different flavors into one of the jars, and then I'm going to swab it onto your tongue, okay? Okay. So with this first one, if I can have you stick your tongue out, I'm going to put this flavor onto the front portion of your tongue. And don't close your mouth when I put it on there. Try to tell me what it is, okay? Good. Don't close your mouth. Salt, good. Okay. Try this next one. This one I'm gonna put on the back part of your tongue, okay? So just don't close. Sour, good. Okay, grab another strip. And our next flavor here. I'm gonna do this one on the front of your tongue again. Okay. Don't close. Sugar, good. Now we're gonna get into some more specific flavors, okay? I'm gonna do this one on the back of your tongue again. Okay. That's vanilla, very good. Okay. This one's gonna be sort of in the middle of your tongue, okay? It's a little bit more of a gentle flavor, okay? Strawberry, very good. And we've got one more. This one's going to be on the front portion of your tongue, okay? It's a strong one. Okay. Grape, very good. That was great. You did an awesome job. A lot of people don't get those. Okay. I'm going to move on to the next part of the exam now. So I'm going to sanitize my hands again. And what we're going to do now, I'm going to be feeling your skin for texture, for any bumps. I'm going to get my fingers down on your scalp and sort of press and feel and just see if there are any irregularities, any soft spots or hard spots that shouldn't be there. Any tenderness, please let me know. Okay? I'm just going to start on your face here. I'm just going to sweep and tap to check the elasticity and just general feel and texture. Have you noticed any changes with your skin? Any increase in acne, oil, dryness, redness, puffiness? Great. Okay, I'm just going to feel into your head now. Any pain with your head at all? Okay. Any increase in headaches or sensitivities to anything? Okay. Everything feels good here. Okay, good. Okay. Let's see what else we need to check you for today. I'm going to do a little bit of sensation testing. So if you could close your eyes for me, I'm just going to take one of my fingers and lightly brush it over your eyelid. I'm not going to press, nothing's going to be uncomfortable. And just say now when you feel it. Okay. Good. 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 I'm going to do the same thing with your lips. I'm going to put a little more pressure so it's not too ticklish, okay? Alright. Good. Well done. Good. Good. Okay, very good. You can relax. I think that is all of the tests that were ordered for today. If you do notice any changes in sensation, whether it's light, touch, taste, hearing, as well as any changes in cognitive ability, so if you feel like you've got some brain fog or you can't concentrate or comprehend as normal, we would like to know about that as well. But at this point, after your injury, typically those things will have already presented, but there still can be issues with your senses, which is why we need to continue to check and make sure everything's healing okay. It looks good at this point. There are many, many bones, however, that make up the skull and all of your different facial features, and if even one of them is out of alignment, it can cause some pretty serious issues in terms of your senses. So we do want to make sure that everything continues to heal appropriately. Okay, but like I said, for now it's looking good. I'm not concerned about anything. I would like for you to contact me if you do notice any changes. Again, my name is Dr. Elo, but if not, I hope that you continue to feel better, and we will see you at your next appointment.